Good afternoon to our professor, Ma'am Carmela Del Rosario. So for today, I will be doing a storyboard on how to correctly perform a urine pregnancy test, a Leopold's maneuver, a fetal heart monitoring using a stethoscope, and postpartum maternal physical assessment. So now, let's move on to the fetal heart monitoring using a stethoscope. Purpose: to check for the rate, rhythm, and the presence or absence of acceleration and deceleration of the fetal heartbeat. Assessment: client's level of consciousness and ability to follow instructions. Client's age of gestation, 5th month or 20 weeks. So now, let's proceed to the procedure. Step 1. Identify the correct patient. Make sure you use two patient identifier such as patient's name and birth date. Step 2. Introduce yourself and state the purpose of the intervention. Hi, I'm R. Stephanie De Guzman. I will be your nurse from 11 a.m. to 3 p.m. Today, we are going to have a fetal heart monitoring using a stethoscope. Step 3. Do hand hygiene. Be sure to follow the 7 steps in proper hand washing. Assist the client to lie on bed. Step 4. Warm hands. Warming hands together will produce resistance. It is classic example of friction. Once you palpate maternal abdomen with your cold hand, it can cause abdominal response, means titigas yung abdomen. Step 5. Expose the part to be examined, keeping a cover on the other parts. Step 6. Perform Leopold's maneuver. Perform second maneuver, which is umbilical grip, to locate the back. Step 7. Place the diaphragm of the stethoscope onto the client's abdomen, where fetal back is located. Step 8. Count the beat in 1 whole minute. 2 beats are equal to 1 count. Normal result is 120 to 160 beats per minute. Below or above this range indicates fetal distress. Step 9. Assist client to get out from the bed. Step 10. Wash hands. Step 11. Record your findings on the client's chart or the record and report your findings to the attending physician. That's all for today. Thank you so much.